Thank you.
Thank you all for coming and being our guests tonight. We appreciate the time you've taken to listen to what we have, and hopefully you'll get something out of this. That's our goal, is to show the difference between who we are and what you have seen out there as far as advertisements. A little bit about me. I'm going to just go through this presentation here. Well, let's talk about why you came. You probably, most of you saw this ad in the paper, and what we wanted to do was kind of give you a difference of who we are. The choice isn't always clear on who does implants and what they offer you, and there's a lot of information out there. So I really want to be able to give you what we do and show you how we stand out relative to what's out there. I think we offer the 21st century technology that doesn't compete, that doesn't match anything of what we do, what's out there. So let me go through it and I'll explain. We are two offices that have teamed up. This is my office at 2801 West Charleston. Some of you know it. I know we have some of our patients here, and I appreciate you coming and sharing your experiences. And this is Nevada Oral Facial Surgery. This is the office you're in now. As you can see, I've been in town a little bit longer. My trees are bigger. So, Dr. Johnson's here. He's representing Nevada Oral Facial Surgery. There's also Dr. Holson. They're an outstanding team of oral surgeons. Now, I'm an expert in building smiles. I'm an expert in doing reconstruction of bites. That's what I do. Dr. Johnson, Dr. Holson, they're an expert in reconstructing jaws. They build the jaws, they support the jaws with implants, and when people have lost their teeth, this is who we need. They do it in a very safe, sophisticated environment, and they do an outstanding job. We've been working together as a team for the last 15 years or so. So I think this team effort is what's different than what's out there, and I really want to kind of hit that home tonight. Again, I'm a general dentist. I do fillings, I do crowns, I do root canals. We do everything that's involved in general dentistry, especially maintenance of dental implants, maintenance of teeth. That's what we do. So taking care of people is what we do. We have patients that have been with us 20 plus years. I've been practicing 23 years in Las Vegas. And we have relationships with them. So who takes care of your teeth after you've had them done, after you've had implants to restore your missing teeth? And those are the things you have to ask yourself. A little bit about me. I moved to Las Vegas when I was about 13 years old. When I was about 14, I guess it was 14, not 13, excuse me. It was the summer before my 9th grade year. My friend was visiting from New York, that's where I was from. And my parents decided on a Sunday to take us to a water park. Not the water parks of today that you have that are very protected, you know, they know how to take care of their safety issues, they're designed for safety, excuse me. So we went to this place called Lake Dolores between here and Barstow. Did anyone remember? Yeah. Yes. And so we go out there, and it's about 2 hours from here. We get in the van on a Sunday, pack the cooler with food, pack the cooler with drinks, towels to go swimming, and it's really just a mud hole. I mean, there's 3 slides. There's one main big slide and there's 2 small slides. And we thought, great, we're here. We got there after 2 hours of driving. My friend, my brothers, we went out there, started sliding on the slides. Now we go down, you know, like Superman, go down sitting down. It was a lot of fun. But what ends up happening is the second time I go out, I see these bigger kids on this taller slide, sliding like they're skiing. So I said, well, I could do that. That looks really like a lot of fun. So I go up on the slide, climb up, look around, start sliding. Sure enough, my feet slide out, my mouth hits the metal bottom, knock out my front tooth. So as I'm sliding down that slide, I'm looking for my tooth. I'm trying to find that tooth. I mean, it was just kind of a shock. I get to the bottom of the slide, I drop off, it's like a 10-foot drop into the water, swim over to my parents, I'm bleeding, they give me the towel, the ice, and not a good experience. My parents are upset, my friend's upset, he's visiting, he's going home in a day. We're starting school this next week. So we get in the car, pack up the cooler, drive back to well, before we drive back, my father calls our next door neighbor, who happens to be his brother's dentist, Dr. Clark. Great guy in town, still practicing. He meets us there on a Sunday. I've got the towel. I get in his office after the 2-hour drive back, pull the towel out. My tooth is just, most of it's gone. I say, can you save it? He pulls a little piece out. He says, I can't save it. So that was it. I lost my tooth. I was devastated. So he gives me a plastic flipper that comes in and out. Many of you can relate to that. It's something that comes in and out. You're missing a tooth. You have to have something. It's better than a gap. Well, that was my first experience with a dentist. I'd never been to a dentist before. That was the first experience I had with a dentist. Fast forward a couple of years later, now I was referred to Dr. Mall, the dentist, the orthodontist next to Dr. Clark, who decides that we have to fix his bite because that was another problem. I had a bite problem, and I was missing a tooth. So they decide, Dr. Mall, God bless him, he's passed away, he went to my wedding, great man, decides to put the railroad track braces on my teeth, which, you know, that's how they did it. But because I had a gap, he had to put a spring to keep the gap open. So as you may know, if you take a book out of a bookshelf, the books collapse. Well, the same thing happens with teeth. You have to control the bite, you have to keep it the way it is. So I've got the railroad track of braces with a spring holding the gap open, and you know, that's how I went through school, and it was like I was 16. So now I've got my first date. I go to, it's a first dance. I've got my little beige jacket on, the little boutonniere, going to the girl's house, Lisa, and I show up, I knock on the door, and I just, you know, I just had my driver's license, so that was really big too. 16 years old, knock on the door, and I figured I'm going to introduce myself to her dad. He opens the door. I say, hello, Mr. Hammond. Nice to meet you. I'm here to pick up Lisa for the dance. So Lisa, without a beat, he looks at me and I'm smiling. He looks at me and he looks back at Lisa and he says, he doesn't have a tooth. So that was my experience. I didn't smile. People thought I was kind of angry. I wasn't happy about myself. You know, I just didn't want to smile. So I know how your teeth affect your life. And I know some of you have experienced that. So it's not just about appearance, it's also about eating. So these are things that I've experienced in my life which made me become an expert in smile design and reconstruction. That's what I do. I'm also a general dentist. I do everything related to that, cleaning teeth, maintenance, and so on. So I've also teamed up, as I mentioned, with Nevada Oral Facial Surgery, Dr. Johnson, and you might want to come out here and just kind of show your face. He's an expert in jaw reconstruction. I can't think of a better person for you to go to have your jaws reconstructed. He does it in the safety of this facility. He's been a friend, a colleague for the last 15 years, and one of the best I've ever had the pleasure to work with. This is Dr. Johnson.
Big compliment for him.
Well, it is. Those
don't come too often, so
So he'll have some answers for you if you want to meet with him later, and we can talk. But I want you to know also tonight this is a presentation. I know a lot of you have questions about cost, questions about what can be done for you, but every situation is specific to you. So what we want to do is be able to have you come in our office, which is included in this. There's no fee. Let me evaluate you. Let me see what your goals are, what your desires are. Let's see what we can do. What's your budget? I mean, there's a lot of things that are reality for people that they need to deal with. And so we can work with you. I know we can help all of you. We have helped many people. And so you have to understand, we have to see your specific issue to give you a proper price or fee and be able to evaluate you. Once you see me at my office at West Charleston, we will send you over to Dr. Johnson and they will do a scan of your jaws to see what kind of foundation we have to work with. And let me tell you, he's been able to work with just about everyone we've helped everyone that we've seen that's taken our treatment. So just so you know. So let me begin this, and I'm not going to keep you too long tonight, but just a little more about Nevada Oral Facial Surgery. They're accredited by the Joint Commission of Hospitals. It's a very prestigious accreditation. There's only, and everybody strives for this, but there's only 2 oral surgery offices in this town that is accredited with this. This one, this facility being one, it's the level of a hospital care. So knowing that, you're in very good hands with them, but also as far as level of experience in implants, the other facility that's accredited doesn't compare in knowledge that they have here. So they're way more experienced. They're the best in this city, the best the city has to offer, and that's why we joined them. So when you look in the mirror, do you long for a healthier you looking back? Do you hide your smile? Your appearance is a big part of it, but losing bone, because your bone does go away when you lose your teeth, is a part of it as well. The ability to chew, the ability to digest is part of this. So when you lose teeth, it can be significant. There are studies that show that people live 10 years less time that lose all their teeth than people that don't. There's got to be a reason for that. So this illustration is just to kind of show you, in this particular situation, we have a full, robust jaw with all the teeth. It just shows a bottom jaw. But what you're seeing is an illustration of someone's face. How much support do they have for their face? It fully supports their lips, their facial features. But when they lose teeth, you can lose teeth to infected teeth like periodontal disease. Many of you may have heard of that. Due to decay, tooth loss, the bone shrinks. And when the bone shrinks, the chin starts to get closer to the nose. The face sinks in. This is part of it. And by the advanced stages, you actually lose a lot of bone. And it's terrible. You feel terrible, and it doesn't look nice. And people know it. So what do we do with dentures? We keep relining them. We fill them up. We make these big plastic dentures that get bigger and bigger to fill out the face. That's all we were doing before. So this is a problem with losing teeth. You lose your facial support. We do not offer one solution for every situation, like some of these big box store type implant companies. We're not a one-size-fits-all. We're also not a jack of all trades, master of none. There are dentists out there that advertise that they do everything. They do it all in one office. That's true, but they don't have the expertise to be able to master everything. And you have to take that into consideration. Their pull to you is that they're going to save you money. Not really. We're all comparable. So wouldn't it be better to have the best care you possibly can with experts in the fields? We also have a laboratory on our premises. Victor is my laboratory technician. He has a commercial laboratory on the premises. So if something should chip or break, which things do happen, we can fix it right there. A lot of offices do not have that. That's a very nice thing to have. So having a commercial dental lab is very nice to have, and it's unique. So if they pull you in with cheaper fees, that may be one thing, but you have to consider what you're getting. There can be some problems. And I'm not trying to scare anybody. You should go and search and do your own homework. And hopefully we're giving you information that you can work with, even to ask good questions. This lady came to me from another dentist who was a jack of all trades, had implants and dentures, teeth attached to the implants. It doesn't look right because it's not right. He wasn't an expert in smile design, but he was a jack of all trades. He was able to do it. I asked her to bring me a picture of what she used to look like. This is what she expected. She tells me she looked, this was a few years ago, she told me she looked like Austin Powers. She was just devastated. Poor lady. But we fixed it. But my point is this is, just because they can do it, can they do it right? And this is what you have to consider. This was another one. Again, these are local dentists. These are patients that were referred to me because I am an expert in smile design, but this is what they received. It doesn't look right. It's not right. This was a bridge that was fixed to implants. She says, I kept telling them it's not right. I said, I understand, I agree, we can fix it. Now, did they really save money? They have to come back and redo it. I can't do it for free. So, and then they have to go through the whole process. But we helped them and they were happy in the end. My point is you gotta be careful. Are you able to eat delicious high fiber foods? The only way you can eat apples really is with natural teeth or with teeth that are attached to your jaws. There's the only way. Dentures, some people manage, but it's difficult. It's not easy. Not being able to eat healthy foods leads to poor nutrition, poor digestion, and actually shorter lifespan, as I mentioned earlier. A lot of people come to me and say, I wish I could eat a steak. I wish I could have a salad. They're reasonable things, but they avoid them because they can't eat them. But when you restore their teeth with implants, they are able to eat these things. So anchored teeth help with digestion and improve health. Chewing is one of life's pleasures that a lot of people miss out on. They just don't get to chew. And the things that they want, so they avoid it. They eat yogurts and things that not as fun to eat, let's put it that way. So why are dental implants better than dentures? Well, who wants to put their teeth in a jar? Who wants to take a body part out and put it on the side of their bed. It's just not nice if you don't have to do it. You can avoid premature bone loss. There's no more Fixodent. People struggle with Fixodent and gagging. I know, I see your face. No more worry of teeth falling out. The ability to eat foods is better, and they can last a lifetime. So the question is how do you want to live? It is your choice, and we're here to help you in any way we can. You can live covering up, struggling, not going out to eat. I can't tell you how many people don't go out to eat because they don't want to eat with their dentures out in public. Or you can enjoy life. I mean, that's really what it's about. These are choices, and we're here to help you in any way we can. So the possibility of dental implants, teeth in a day, what does this mean? Well, this is one solution for someone missing half, let's say half to their top teeth or their bottom teeth or all their teeth. And what it offers basically is this is an illustration, is 4 implants. 4 on top, 1 in the back, 2 in the front, 1 on the other side. So it's 4 implants on top and the bridge is attached. And it's one of the best things that's come about. And it's been around now for quite a while, probably 15 years? 12 years. So, and the beauty of it is you never go without teeth. If your teeth are sick or ill, you take them out, you put this in, you walk out with a smile. Your teeth, you never go to a denture that comes in and out. And a lot of my patients that are here will tell you that today. This is Joe. Joe, really a good man. Not a man of a lot of means. He is a plumber. In his 40s, big hockey player, 6'6", maybe 300 pounds, big man. Had his teeth knocked out, went to his dentist. They took out his teeth and put him in dentures, top and bottom. Joe was miserable. Joe would go to a bank and his teeth would be in his pocket. Before he walked in the bank, he put them in his mouth. He told me, he put them in his mouth, and he would struggle because he gagged. He hated the gag, the reflex. He just couldn't handle having his palate covered with a full denture, a plate. And so he went like that for 1 or 2 years. And when I saw him, I said, Joe, have you ever considered getting implants? And he said, I didn't know I could have them. I was told I couldn't. This is what he was told. So I said, well, let me send you to Nevada Oral Facial Surgery. I said, let's have your jaw scanned. And we did. And sure enough, just like everybody else we've sent, they scanned his jaw, and sure enough, he could have them. In a day, after doing some impressions and creating the teeth, he walked out like that. Joe has never been happier since. Joe came one day, he did chip one of the teeth. He came and I said, we can fix that for you, that's not a problem. Things happen. And I said, do you have any regrets about what you did? He said, no. He says, I'm so happy. The best part of it is I can crunch foods again. And they feel like they're part of me. He felt that freedom. So the advantages of this type of surgery, the all-on-4, is quicker healing recovery time. Same-day replacement of your teeth. You never go without any teeth. There is less cost, and there's no grafting, which is something that we used to do in the past to rebuild jaws. And Dr. Johnson can certainly tell you about that. So here are cases of people like this lady here that the smile wasn't constructed properly, and she doesn't look right. So when the smile is restored and constructed properly, she did not lose weight, she did not have cosmetic surgery. We just reconstructed her smile. And that's what you're seeing, and both of these ladies. So it's not, you can change appearance by improving the support for the face, which is what I'm an expert at. This was a nice lady, very nice lady. Her daughter referred her to me. This has been several years now. And her chief complaint, because that's an important thing, we want to know what's bothering her, is she felt, her granddaughter thought that she looked angry all the time. And she thought she was angry. I said, well, I see the problem. The teeth aren't right. So we can fix that. I said, we'll rebuild your teeth and do it properly with implants. And we did. And she looked so much more pleasant. And you could see even the support for her face. She doesn't have the jowl she has here or there. She did not lose weight. She did not have cosmetic surgery. This is just her teeth. What a change. So why are implants better than dentures? Well, now you know. They shouldn't come out of your mouth. No body part should have to come off if it doesn't have to. Bobby, she's a patient of mine a long time. We take care of our patients for years. They're part of our family. This is what we do. She came with an upper denture, lower teeth that were infected, sick, and hurting her. She was very unhappy. We just put implants in, restored them with implants, or with teeth, I'm sorry, and look at the change in the shape of her face. This is not a weight loss. This is just the appearance change based on fixing the problem with the teeth. The teeth had worn down and collapsed. We are outliving our teeth, and we have to keep up with them. So Balle Associates and Nevada Oral Facial Surgery can help you bring back your smile and happiness. That's what we're about. We create a more youthful, refreshed appearance, and that's what we're hoping to do. We have transformed more than 10,000 lives over 23 years I've been in practice. This is a passion for me. As I explained to you, I went through something like this. I know what it's like not to smile. You know, and it's not very nice. So what makes us different? We customize our treatment to fit your needs. We give choices. We have options to fit your budget. We just need to know what it is your goals are, and then we can sit down and talk. So to give you numbers with just seeing you in public isn't fair to you. We really need to see what your conditions are and what your situation is, and what you want. That's really important. There are choices, and we're not one size fits all. What makes us better than a clear choice is we're not a large corporation driven by profit. We've been doing implants longer than Clear Choice has ever been around. We offer affordable treatments to change your life. That's what we're about. We accept dental insurance, unlike Clear Choice, because they only have one-size-fits-all mentality. Although they can do a good job, it's not everyone needs 4 implants and a bridge. It's not the same. I have seen that. People have come to me, and I'll show you some cases, that didn't need that kind of care, and that's what they were offered. We also offer the teeth in a day concept. Our customer service is head and shoulders above the rest, and we take care of our family of patients, as do Nevada Oral Facial Surgery, and we've come together as a good team, and I think we do the best we can for this town. We can provide transportation a day of surgery. We've done that for many patients that have a hard time getting travel because you have to be relaxed, and the medication can make you so relaxed we really don't want you driving. Susie comes to me from California, referred by her dad of many years. He passed away, really nice man. And I finished her treatment probably 10 years ago. Susie had severe asthma, always dry mouth, dry environment. When you have dry mouth, your teeth decay, and that's a big, big problem. And that's true of people that are on a lot of medications as they get older. Their teeth break down, and it's because their mouth is very acidic. So Susie's teeth were breaking off. She lost the one there that you see missing. And she was going to a very nice dentist in California that took care of her, but he kept replacing, putting bridges, and finally the teeth were just falling off. So with Susie, she did not need all on 4, but I was able to save some of the teeth, but the implants were put in the back, and we restored her smile with implants. Now, nobody wants implants. They want nice teeth. They want to be able to chew. They want to be able to smile. Susie does that. Susie travels from California 4 hours every time she has a cleaning to see us, and we take care of her. And we have had a long-term relationship with her for for 10 years, and she's very happy. She's one of our biggest rated fans. She'd love to have you call her if you wanted. Frankie's another lady from California. I don't know why California. I guess they're our big neighbor. Had a partial that came in and out. Hated teeth that came in and out. Just didn't like it. Wanted to know what we could do. The other teeth were failing her. So in her case, all teeth on top came out and 4 implants went in. Same day we attached teeth, so she brushes them and cleans them in her own mouth. She smiles and eats with it. It's something fixed. She's so happy to have something that doesn't come in and out. That's where we're at with her. And I just saw her a week ago, and she's very happy. Dan's an interesting situation. Dan really didn't worry about the way his teeth looked. But Dan's teeth were failing because of periodontal disease. Due to the periodontal disease, his teeth were starting to loosen. So Dan enjoyed eating corn on the cob, ribs. If he bit down on anything, these front teeth would wave. So he was afraid, just biting in anything, he was avoiding foods. He was afraid he was going to lose his teeth. So he saw Dr. Johnson. We prepared a bridge, top and bottom. He took out all the teeth, top and bottom in one day. They were so infected, there was nothing else we could do with it. 4 implants on top, 4 implants on the bottom. We attached the bridge, connected it. This is how Dan walked out of our office. Dan hasn't been happier since. He's an electrician. He didn't have work here. As you know, the economy was bad, and he ended up going to Ohio. He went to Arizona, and he's back. He comes in and sees us from time to time. I put Maria's picture in here because Maria really wasn't so much an implant patient. Maria just had which she considered unattractive teeth. They were yellow, stained, and discolored. They were strong, but they just didn't look nice. The point is, as a general dentist, we have a lot of tools in our toolbox to fix their problems. She just needed veneers. I couldn't get her to smile. This is how she smiles before we fixed her teeth. Once we fixed her teeth, her smile readjusted. So this is something we can certainly do for people if that's what they need. We need to see each individual situation. Dan was retiring from the Air Force. He went to his superiors or his dentist in the Air Force. He had partials, top and bottom. He hated his partials. They told him, your teeth are failing due to periodontal disease. You're going to have to go to dentures. So he said, I have to get a second opinion. Well, we ran our ad, second opinion, and Dan came to us. He had just retired from the Air Force, and Dan said, can you help me? I said, certainly. Let me send you to facial surgery. They did the scan. Sure enough, we put 4 implants in on top, attached his teeth, and he never had to have a denture coming in and out of his mouth. By the way, his wife was wearing dentures, top and bottom, and she hated her dentures. Wouldn't go out to eat. One of those people that stayed home because she was embarrassed of her teeth coming loose. She ended up, because she saw Dan get his teeth fixed, she came in and we did top and bottom. 4 on top, 4 on the bottom, attached the bridges. The lady hasn't been happier since. Dan still has to do the bottom, but he's waiting, he's budgeting. One of our youngest patients, Ken. Ken, 30 years old, was on a date. He had a partial, he had bad teeth. And this tooth broke loose, the partial fell out on his date, 30 years old. 30 years old, he doesn't want to have dentures, he wants to have teeth. And so one of the solutions was the all-on-4 concept. 4 implants on top, the bridge on top, and we connected it in one day. He's ecstatic. What does this do for Ken? He doesn't lose bone. He has many years of life to live with bone staying there. If he were wearing dentures at 30, the bone diminishes very fast. And some of you may have experienced that. Donna's another lady from Lake Havasu. Her teeth, she was wearing partials, her teeth were loosening, they told her she needed a denture. Well, she did not need an all-on-4. She just needed some of the teeth removed and some implants, so we did a section of implants and some teeth with bridges, natural bridges. This is 7 years ago, and everything's working just fine. You have to see the situation for each individual. So, we offer a safer, more affordable procedures. We offer custom financing. It's completely confidential. Nobody has to know. Although a lot of our patients here are happy to share their experiences with you because they're happy with what they did. Our approach is customized to your individual needs. We want to address a very refreshed appearance, happy appearance in a low-risk situation. And there's very quick recovery, as some of our patients will tell you. Did you know we're one of the most experienced teams with thousands of successful cases in Southern Nevada? We are. We have. I probably am the most experienced general dentist in doing these cases. So, and having the support and the relationship with Nevada Oral Facial Surgery has made us even that much better. This reminds me, I had a patient that was a UNLV professor, and I may have shared it with some of you. This professor had a speech, he had to start teaching in the coming fall. This was last year, or was it 2 years ago?
2 years ago.
2 years ago. And this man had a partial, and his teeth were failing, they were starting to fall out. And he couldn't hold his partial in. He went to his dentist, who said, I can't help you. He said, well, what about implants? She says, I don't think you can have implants. So she sends him to her oral surgeon, not Nevada Oral Facial Surgery, another oral surgeon. Says, does an x-ray, says, I don't think you can have implants. So this poor man has a week or 2 before he has to teach at the school, the university, in a setting teaching mathematics, and his teeth are falling. I said, I'm pretty sure, well, we ran the second opinion ad. So he saw the second opinion ad, and he came to us, which is good. I said, I think we can help you, but let me be sure, let me send you to Nevada Oral Facial Surgery. They'll do a scan, they'll see what kind of foundation we have to work with. Well, sure enough, the week before he had the lecture, he had teeth in his mouth. He was grinning from ear to ear. Did not have to worry about his teeth falling as he was talking. So we have helped a lot of people, and that's what gives us a lot of pleasure. So we do offer excellent customer care. Nevada Oral Facial Surgery has a team of experts and a great support staff, as well as we do. I think my team is, bar none, some of the best. They do the best they can to help you and find a way to help you achieve what your desires are. Of course, there's payments. We can always do finance, you can always do credit cards. These are things I just want you to know that's available. Some people choose not to, some people choose to get travel miles. There's also financing through dental companies that specifically finance people's dental needs. So just so you know that they're available, you can also go to your own bank, as Cindy recommends sometimes, if you have a good relationship. They finance these kind of things. So the question is how do you want to live? This is the big question. It's up to you, and we're here to help you in any way we can. We have different choices, different options. We're offering you a free consultation to see what your conditions are, as well as Nevada Oral Facial Surgery is offering the free scan. So we can at least come up with a plan if that's what you want. We need, if we know your budget's even more helpful. So don't just take our word for it. Listen to our patients and their stories.
Really bad experiences. Okay, I take full responsibility though. It sounds like an Earhart sensitivity thing here, but I take responsibility. I was not good at being consistent with my dental care, but I'd had some horrible experiences to the point that I was so fearful that when I went to places, because I knew I was having troubles, I spent a lot of time laying on a table or laying on a bench out in front because I was hyperventilating. I was so worried. It got to the point, being in sales, that I knew I was having continuing problems, that I had to do something. So I started about a 1.5 year long search on the internet. And I would highly recommend don't do it, because you read all these things about all these people, and yeah, we can fix everything for you, and it's guaranteed in 2 years you're going to love it. And I'm thinking, as awful as this procedure sounds, going through the removal and how do you do your job and what about this and what about that, I thought, you know, that added another 1.5 years for me making a decision to move ahead with where I am now. And I think more than anything, as I look back, being able to call and talk to, I had 3 other appointments set up. And I came here and I met the doctors here, and everybody treated me very nice. They allowed me to fall apart into a big puddle of goo because I was so terrified. And I couldn't imagine anything being improved. Seriously, it got that bad for me. I thought I was going to lose my job. I thought I was losing my friends already because they didn't know who I was. I wasn't the same person. I'd forgotten how to smile. So a lot of the situation, when you get to that point, and I hate to sound so energized about it, but now, after coming here, finding out that everything that was told to me was absolutely true. I mean, there was no misrepresentation. Maybe it was even, I didn't believe it. And so you go through the procedure. It was October 2nd for me. And by October 3rd, I'm sitting there in the bathroom, staring in the mirror going, that's me? Seriously. And I don't know how you tell people the impact that it has on your life when you spend so much time running around not smiling, not looking at people, putting your hand up, trying to do this and that. And that started here. It started with a phone call, actually, that got me here, and then it got me to Dr. Balle, and then it got me, everybody was so supportive. And now I've kind of started a quest of my own, I think. A lot of things have changed for me, but I think the biggest thing now is I'm really aware of people that are having dental problems. And I'm not going to be a dentist. I'm 57. I would be a terrible dentist. So, but what I noticed about myself is it's funny how life sort of brings you things. And I've gotten to the point where I've seen some people have some problems, and you're able to kind of talk to them. And you got to be careful. You don't want to just spill your guts about everything, especially if maybe they don't know you well. But to be able to tell them, don't be afraid. Go out, do this. All this is available for you. And all I'll tell you is, I'm not even at the 6-month point, and I still wake up in the morning going, I can't believe how perfect this worked out for me. You know what I mean? I mean, it's hard to put into words. So I think that's why I'm here tonight more than anything. It's the same thing that I do every single day when I'm around people. And it just happened earlier this week when I was traveling in Northern California. Someone that I know was speaking about their dental problems. They didn't know or making a connection to what I had been through and the improvements that I had. But it was so nice to be able to say, don't be afraid. Take care of yourself. Do it. Give yourself that gift. it's the best thing you'll ever do. So that's why I'm here tonight. And I mean, I'm serious. I don't know what I would do. It started with a phone call, and I went through those other appointments in town. I didn't lie about it. I did it. I went through and talked to other dentists. And I came back here, and I saw Dr. Balle, and everybody took such good care of me. I'll never regret it. Seriously, it's that good. So if that's one thing you can get from talking to this guy, Chuck, don't hold back. Do what you need to do. And you've got a good supportive group of people that I've never been happier. So there you go.
I lost my teeth, my front teeth, when I was about 14 years old and got a flipper. And that's quite young to have to start not having teeth. And I'll never forget the first time I was playing tennis. Right after I'd had it done, got my new flipper. And my teeth flew out when I went to hit a backhand something, and I was just mortified. And I thought, okay, that'll be the last time I ever open my mouth again. And after that, it was constantly trying to hold my mouth closed, and I didn't smell, and I was young. I was just a kid. That's how I grew up, thinking that that was as normal as I was ever going to get. And
how long did you wear that flipper for?
From 14 to 50.
Wow.
Long time. Then when I was actually I had lockjaw problems, I was having some problems, I actually got referred to oral maxillofacial for that. And I had gone to see a dentist, and the dentist wanted to do all this other stuff, and I just avoid dentists. I avoid them. I just don't like them. And I had been referred to oral max by this other dentist. And Dr. Holton could immediately pick up that I wasn't comfortable, and the concerns that I had about my dentist. And I'll never forget, he told me, he says, you know, I have nothing against this dentist, I think that they're all good, but I think that people have a certain fit. He says, and I have a dentist that I think you would fit with really well. And I thought, yeah, right. But then I went to Dr. Balle, and oh my God, I cannot tell you, it really is true. I love going to Dr. Balle's office. His staff makes you feel like family. They fool you into doing stuff before they even do it. I'm just like, next thing I know, I'm in the office and I'm just happy, and I'm like, oh, you're gonna do what? But they're just great. After I got my teeth, I'll never forget the first time I went to, it was so automatic for me to pull my teeth out, and after I got my teeth, I was like, oh yeah, don't have to do that anymore. And I smile now, and I haven't smiled since I was a kid. We have 3 boys who all went through orthodonture, and it was quite expensive. And every time we'd go to the dentist office, the orthodonture, the first time I saw the implants, I remember picking up the brochure and showing it to my husband, saying, oh wow, this would be nice. But it's a pipe dream, it'll never happen, because we'd never be able to afford it. And when I met them, and it was made it possible, I mean, it was financially possible, being the frugal one I am, I'm like, no, we can't afford it. My husband said, listen, we put dentures on, we put braces on all your kids, we spend all the money on the kids, it's our turn, you're going to get your teeth fixed. And I can't thank my husband enough for forcing me to do it, because once I did it, once I got past the financial, worrying about the finances, or it's the best thing I feel, probably younger than I have felt since I was 14.
Thank you.
Hi, my name is Michelle Vivian. I came to Dr. Balle to have some treatment, as I've had for years and years on so many problems. I've had root canals and extractions and always a lot of pain, and my gums would hurt. And anyway, he explained to me some of the options I could have, which would have been, you know, either all-on-4, dentures, orthodontists, because my bite was terrible. My teeth, bottom teeth were in front of my top teeth, and I never wanted to smile. I would cover my mouth, and then I had missing teeth for crowns that, you know, went bad and came out, you know, just would, like they talked about, just would fall out when, you know, I'd be out somewhere and have to run in a bathroom. It just was becoming so, you know, embarrassing. So when he gave me the options, I knew I didn't really want dentures. My mother had dentures very young. She was only 25. And all the years I remember her being really embarrassed and it really bothering her. So that really wasn't an option for me. And when they gave me the explanation, the all-on-4, and the same day I would be walking out with teeth, no missing teeth, no leaving without teeth, I was sold. And you know, of course, all the prep and the office staff, they were fabulous. Everybody was so kind and explains everything to you and makes you feel very comfortable. And it's been a pleasure. You know, and even after the surgery, I still had to remind myself I could smile. You know, I could smile. I could, you know, feel good and eat things without worrying about teeth falling out. And so it's been very nice. And I've been very happy. The doctors are great. I didn't have any pain. It's just a good experience. And I would recommend it to anybody. It was the best thing I've ever done. Thank you.
Thank you.
Hi, I'm used to speaking with both my hands because I'm originally from New York, but I will try to hold this microphone steady. I have been in Las Vegas since 1965, and when I came here, and way before that, because I'm older than dirt, but when I first came here, I had so many dental problems. I had caps on all my teeth, and then I went to a nice dentist here who said to me, you know, Sidel, your teeth are falling out, but if we redo all your crowns and we put posts in, and that was a very expensive procedure and time-consuming and painful, but I went for it because I ran the senior division for the city of Las Vegas for 35 years, and I was always public speaking, didn't want my teeth to fall out, so I redid all my teeth on posts, and I was very happy for 2 months. And then I brushed my teeth and my teeth fell down the drain. One by one, they were coming out. And there was nothing I could do. I didn't know what to do differently. And so I had to go have all of my teeth out. I did it when I retired in 2005. And I wore a plate for 4.5 years. And I am telling you that glue is not nice. And I also will tell you that I know it's disgusting, but you can't spit when you wear a plate. Because I almost lost my teeth out of my car. Because I put a candy in my mouth, and I know it's terrible, and I opened the window, and I spit, and I didn't realize my plate almost went out. And it was a horrible thing. And you can't blow. You can't do that with a plate. So my husband had gone to Dr. Balle, and my husband really dislikes dentists. He really does, but he loved Dr. Balle. So I said, well, then I'll go. And Dr. Balle talked to me about the implants, the all-on-4, and I thought, you know what, I'm going to try one last time to lead a nice, fun life and have my smile back, no flippers, no teeth falling out. And then I went to Dr. Johnson. And these two men are fabulous. And the staffs are fabulous. And I am telling you, I absolutely love my teeth. They don't come out. Because every time I took my teeth out to clean them, my husband walked in the bathroom. And I don't care how much makeup you have on. When you take your top teeth out, you look awful. I mean, really terrible. The only time I took my teeth out is when I ate C's candy. And then when my husband would walk in the room, I'd give him a big smile, and he'd say, "Oh, you're eating C's." Because you can't taste when your palate is covered. So all I'm telling you is, since I met these two men and their staff, I am the happiest lady. I have beautiful teeth, fabulous time, and life is good again. So if you're going to do anything, this is the place you need to do it.